ACL tear in children. Friends, this is a very severe injury of the knee which happens in a childhood sometimes due to the sports. And what should be done if your child get an ACL injury? My name is Dr. Manu Bora. I am an orthopedic surgeon and a sports medicine expert, Team Ortho Sport, Gurgaon, Delhi and Bombay. So friends, ACL is a ligament which gives stability to the knee. Sometimes during the running or maybe while playing, the child can hurt his knee, and due to that trauma the ACL can get break. If the ACL is damaged, it is completely torn, then the knee will become unstable. Unstable means that the child will complain that there is some pain in the knee. He might complain there is a locking, or he might complain that the knee is not stable, it is giving away, and he or she is afraid to initiate the running or maybe change of the direction. And if he is climbing up and down the stairs or maybe doing hiking and trekking, going on an uneven surface, then the knee can be wobbly and unstable. This can lead to further degeneration of the meniscus and cartilage. So sometimes the surgery is very necessary if the child has a complete ACL tear. Most of the surgeon will not operate on the child. Why? Because the conventional method of surgery uses screws in ACL reconstruction. And if we use a screw, the screw is going to cross the epiphyseal plate. If the screw crosses the epiphyseal plate, what it means? It means that the growth of the child of that particular leg is going to be hampered after the surgery. Why? Because this is the epiphysis where the growth occurs. In tibia, the cells are moving downwards. In femur, the cells are moving upwards. So any implant during the ACL reconstruction, if it crosses the epiphysis, if the screws crosses the epiphysis of the tibia, or if the button crosses the epiphysis of the femur, is going to hamper the height of that particular limb after the surgery, and there might be some limb length discrepancy later on. So most of the surgeons will say, okay, let's wait for a few years, let the epiphysis starts closing and then we perform the surgery. Those few years can be very dangerous for the health of your child and its knee. Why? Because the constant wobbling, there can be a permanent damage of the cartilage and meniscus. The weight can increase, the child will not able to play, he can go into childhood depression. There are so many problems which can occur. But now we have a solution, which is known as all epiphyseal ACL reconstruction or all epiphyseal ACL repairs. The best one will be all epiphyseal ACL repair with fiber tape internal brace. In that, we repair the torn ACL. Repair can be done if the ACL is torn from the femoral end. So we repair the ACL and we protect the ACL with the fiber tape internal brace. When we do the surgery, we do the surgery under the image intensifier. It's a kind of big machine in which we can see the real-time bone. So we know where is the epiphysis. Different kind of zigs are used for the femoral and tibial tunnel. It is an all epiphyseal kit by Arthrex. So when we use these kind of zigs, the femoral tunnel will be made below the epiphysis of femur, and tibial tunnel will be made above the epiphyseal of the tibia. So it doesn't cross the epiphysis. Secondly, we don't use screws in this surgery because screws are very big, it is bound to cross the epiphysis. So we will be using button on the femur and button on the tibia. The only button which is approved by the FDA is tightrope RT by Arthrex. So only Arthrex has an instrumentation for the ACL surgery in children, and only that implant is approved by the FDA. No other company has any implant which is approved by the FDA. The first implant in the world which got the FDA approval is tightrope RT. So only surgeon who is regularly doing all inside ACL reconstruction with fiber tape internal bracing can able to do this kind of surgery, in which the ACL is repaired and it is protected by the fiber tape internal brace. The child can start walking from the day one. There will be negligible pain. Why? Because no tendon has been harvested. The bone hole is very small because we need to drill the bone only for the fiber tape but not for the tendon. And we have repaired the original ligament, so the nerve vessels, the blood vessels, the nerve endings, everything is intact. So the recovery will be very fast, very quick and almost 100% complete. If the ACL is torn from the mid part, then we will be performing ACL reconstruction with fiber tape internal brace, all epiphyseal. So all epiphyseal means that we will be using flip cutters. It can be done only by the use of flip cutters and image intensifier, of course. So we will be making tunnels with the help of image intensifier and a special zig so that the flip cutter doesn't crosses the femoral epiphysis. In normal surgery, what the surgeon do, they make a drill by using any kind of rimmer which is going from inside the joint to the outside. This is called as inside out drilling technique. This is going to cross the epiphysis. But in all epiphyseal ACL reconstruction, we do the drilling outside in, like this. So we can determine if we are crossing the epiphysis or we are not crossing the epiphysis. For the children, we don't cross the epiphysis. And for the tibia also, we don't cross the epiphysis. In both the drilling, the flip cutter is being used and we use tightrope RT button, which is the only implant in the world approved for the children. Fiber tip internal bracing is done so that the patient can walk from the next day. He can do full weight bearing from the day one. He can bend his knee, bend her knee from the day one, and there will be negligible pain because we are cutting the bone through flip cutter. So if your child is having any kind of issues in the knee due to the injury, pain, instability, swelling, so it is very important that you go to a nearest orthopedic surgeon immediately, get the MRI done, and you can send us your MRI report so that we can tell what will be the best solution for your child. We care about you.